Hi, my name is Dr. Tom Hamline. As many of you, if not all of you know, I am the president and CEO of Help USA, and I've been pleased to be working here for almost 27 years. And just to prove that, I'll show you my Help coffee cup that I probably got 25 years ago. There it is. The paint is wearing off of it, but it still serves its purpose. We're here today at this town hall to discuss the COVID-19 pandemic, our responses to it, what help is doing to work to mitigate the effects of this pandemic, and also to answer your questions, any questions that you may have. Um, Let me start very seriously. I think it's important for all of us to recognize and to really ponder the fact that in the United States of America, we have had over 429,000 deaths from COVID-19 to date, to today. We will exceed 450,000 deaths as a country by the end of next week, and we'll probably reach 500,000 deaths by the end of February. This is just to say that this is a very serious situation that we face as a country, and a very serious situation that we face as a large organization working in many locations in this country. I want to begin by urging everyone to follow best health practices and to continue to do all the good things you've been doing to mitigate the impact of this pandemic on you, on our clients, and everyone associated with help. In a nutshell, these practices involve staying home if you're feeling sick. So staying home keeps you from spreading this to others, both clients and staff. And so please remember, stay home if you feel sick. Practice social distancing is another thing that there's been a lot of talk of, remains very important, and wearing a mask. That is also a very key factor in keeping the spread of this pandemic down. And the last one is getting a COVID vaccination. I had mine about 10 days ago, and both personally and professionally, I recommend that you do the same. Please understand that this is not a mandate. This is not a Help USA requirement in any sense. It is merely a recommendation, and one that I feel is supported by medical science and by all we know about this pandemic. So again, we're not mandating a vaccination, but it is recommended, and I hope that you all have occasion to do so. Thank you for joining us today, and I hope that you learn and benefit from this town hall conversation. And I'm going to turn this over now to Steve Mott, my chief of staff, and to a special guest, Dr. Azen Quayle, who is a physician who is very experienced in talking about COVID-19 issues. Steve?
Thank you, Tom. I'm just going to wait one more second for Dr. Azen. Thank you, Tom. So I wanted to start by explaining who I am. My name is Steve Mott. I'm the chief of staff at Help USA. I've worked here for not as long as Tom, but I'm not as old as Tom, so I get credit for that. About 8 years, coming on 9 years. You know, the purpose of this conversation and the reason we invited Dr. Azen Quayle here to speak with us is to continue the conversation about COVID and about the vaccination. The purpose of this town hall, specifically this portion, is to give you an opportunity to get some of your questions answered that you might have, and to give you all an opportunity to become experts in the field yourselves so that you can go back and talk to other staff members, your colleagues, and people you work with. I'm really excited that 230 of you have joined us right now, but the organization has over 1,000 people who work here and another 10,000 people that we serve every year. So the key here is to give you all the knowledge that you can possibly have so you can make an informed decision about the virus and about the vaccine, and give you that knowledge so that when people who trust you come to you to ask questions, you have the facts at your fingertips. So I wanted to introduce our guest today. This is Dr. Hugo Azen Quayle. and I'm going to go through your bio if that's okay. He's the chief of emergency medicine at Mount Sinai, Queens, and associate professor of emergency medicine at the Icahn School of Medicine. He received a degree in medicine and a degree in public health from Johns Hopkins, and he trained in emergency medicine at the University of Pennsylvania. He's won like 1 million awards for his work, but I won't list all of those, lest I embarrass him. So welcome, doctor. Thank you for joining us.
Thank you for having me.
Is there anything I missed in your bio that you wanted to highlight?
No, well, actually, a couple of things. I just wanted to say thank you guys to your organization for having me. I looked up at your website at the work you do, and thank you for the fascinating, incredible work that all of you do to helping those who may be a little bit disadvantaged at times. Thank you for the work, and I just want to let those know. I know this organization started in Brooklyn, so I know it's a national organization now, but I am from Brooklyn. I live in Brooklyn. I live in Crown Heights. My barber is from Utica Avenue, so I haven't gotten a haircut in a while, but so you know, I am from the communities that we serve. I live there with my family. They all go to school in Brooklyn. So thank you for the incredible work that you guys do.
Thank you so much. So just to start, I wanted, if you could give us just a brief rundown of what it's been like to work in an emergency department in Queens for the last year.
So it's been incredible. So we first got wind in January of 2019 that there was this new virus that was making its way in China and in Europe. And we were able to So we were able to actually sort of understand what was going on. We're like, okay, we need to prepare for it. But when it came very quickly. And by sort of late February into March, all of a sudden our emergency departments were inundated with EMS calls, ambulances coming in. And before you know, we were in crisis mode. The hospital capacity got filled very quickly. And I don't need to show you the graphs and everything that happened. You guys know what happened during the first wave of the pandemic. There were a lot of lives lost unnecessarily, if you ask me. But we managed to pull through that first wave, and now we're here through a long summer, and now we're doing the sort of the second wave, which is not as bad as the first wave, but it's nonetheless here. We're still seeing patients, people show up to the emergency departments. We're still seeing them show up in the intensive care units. And unfortunately, we're still seeing quite a bit of people die, which is not the outcome that we want. And so this is very important that we all maintain our vigilance. I know it's been a year plus of wearing masks and being away from family members and socially distancing yourself. But some of those practices make a big difference. And I will tell you, in New York right now with our second wave, we're starting to see a downward trend, knock on wood, over the last week and a half of actually positive rates starting to go down. So they're closing the indoor dining and sort of still separating yourselves and wearing masks. All those things make a difference. But more importantly now, we have to think longer term, and the vaccines is the next route for all of us to take to make sure that we keep ourselves safe.
Great. So with that segue, I wanted to ask you, what is this vaccine? There's a lot of confusion about what the vaccine is, how it works, why there are two different vaccines. So could you just give us a brief understanding of what the vaccine is, what it does, and is there a difference between the two we've been hearing about?
Yeah, so that's a great question. So, vaccines essentially are there to prevent the virus from actually taking hold in you, the host. And how does it do this? It actually stimulates your own body to create antibodies. And antibodies are these protective cells that prevent viruses and sort of kills off the virus. So a vaccine could be a dead part of the sort of inactivated part of the virus itself. So it's not a live virus that's being inoculated and injected into people. And we've had vaccines from smallpox to shingles to hepatitis B, you name it, we've had vaccines as part of our lives. And all your children who get measles, mumps, rubella, those are all vaccines. So vaccines are being part of our sort of lexicon of what we do for sort of this drug therapy and preventing viruses from taking hold. Now, the thing about these two viruses is the technologies, and you've heard about this messenger RNA, which is this sort of novel technology which nobody's heard about since 2019, really. But I'm going to tell you that that technology has existed for years before the late 2019 when the coronavirus 2 came about. And it's important for us to recognize that the SARS-CoV-2 is actually a second variant of coronavirus. There is actually the first SARS-CoV-1, which has been in existence since 2002. So we're talking about 18 years now. So there's been a lot of science that's gone into developing vaccines that have now gone for 20 years. So when people say, oh, this is fast, this is developed so fast, that's not so true. There's been SARS-CoV-1, there's been MERS, which is the Middle Eastern Respiratory Syndrome, which is also a coronavirus. And that's been that was described in 2012. So we've had a lot of experience with coronavirus. The messenger RNA, which is really a genetic code that allows your body to make proteins. So this messenger RNA is inserted into this cell. It does not go into your nucleus, meaning that it does not integrate into your DNA. So it does not change or mutate anything about you as a human being. All it does is in the cytoplasm, is quickly degraded. But what happens is because it has a genetic code that is sequencing for the protein, the spike protein, you may have seen the coronavirus looks like a ball with these little spikes that come out of it. Well, those spikes are what lets it get into the body. And so what essentially has happened with this messenger RNA is introduced into your body a little sequence of that spike protein. And guess what? Your body makes antibodies towards it, and lots of antibodies. And so the next time you get exposed to the real coronavirus, guess what? Your body is not able to protect itself. So that's what a vaccine is. Now, Moderna and Pfizer, they created the two vaccines that you hear about now, and they use the messenger RNA technology, but they essentially work the same way. What I just described here is how both vaccines work. And essentially, you get the vaccines, you protect yourself. The next time your body comes in contact with the virus, it gets protected. So just because they're two different manufacturers, the technologies are similar and the outcomes are the same. Does that answer that question?
Yeah, that's great. And so to follow up with that, and just so everybody on the call knows, these are all questions that we got from you emailed into the organization. If as we go along, you have some more questions that you would love the answers to, just put them in the chat. I'll try to look over there. I'm going to get through the ones that were emailed in ahead of time, and then I'll take a look. So some people are wondering, what are the side effects of getting a vaccine? If they go, what should they expect to have happen? We've heard some horror stories about people having allergic reactions and people tremoring. What kind of things should people expect if they decide to get the vaccine, and how dangerous is it?
So majority of people who get the vaccines, they really have mild non-specific symptoms. So you get the first, like when I got my first dose, my arm ached. You got a shot in your arm, it ached a bit, but that went away. The second dose, the second time I got a dose, my arm ached a bit again where they injected, but then after that, it got better. I got some chills at night. The next day I was fine. So really mild, non-specific symptoms, that's what you get. And actually getting symptoms is a good thing. That tells you that your body's immune system is working, and guess what? Creating antibodies. Now, there is a small subset of people who have a history of bad allergic reactions, really severe allergic reactions, who have now gotten even allergic, what we call anaphylaxis, when they got the vaccines. Fortunately, we have medications that could mitigate against that. And whenever you're getting the vaccines, wherever you're getting the vaccines, they make sure that they have the anaphylaxis kits around. So you should be protected if that happens. They will ask you those questions. So please be honest if you have a history of severe allergic reactions, that you actually say so. Most people will get the vaccines though and do well. Both trials that they have for the Moderna trial and the Pfizer trials, we're talking in the order of 2 to 3% of people got even these mild reactions. So fairly mild, and most people will do well, get the vaccine, go home, and nothing happens.
So some people are wondering, and we got this question a lot, that since they've only been giving this particular vaccine out for a short amount of time, in New York only a month or two, wouldn't it be better just to wait 6 months or wait a year before people decide to get the vaccine?
So great question. So traditionally, that's how we do. So that's how vaccines get. They go through clinical trials, they get through phase 3 clinical trials, and then there's a built-in time after that, a year, 2 years, 3 years before the vaccines are introduced into the community at large. The problem with that is exactly what your CEO just said. 429,000 people have died. And by the end of February, we anticipate 500,000 people. We just can't wait. We really have a vaccine that the trials have shown that it works. The study itself that they trialed it in, there was no shortcuts in the study. It was done the way it should have been done. It was followed phase 1, phase 2, phase 3. And then after the phase 3 was completed, they actually gave it another 2 months after that to see if there was any adverse effects. So there was no shortcuts in the science. And so I just wanted us to be critical, but that is why we are in the middle of an pandemic. Over 2 million people have died worldwide. And I think we need to sort of understand what that means, right? If we were in an external war right now with some other country and 450,000 coffins were being flown back to America with the flag draped over them, guess what? We will be having a completely different conversation right now, right? Most people will be talking about how can I draft to go overseas and help? But because this is an invisible enemy, and because we don't see, some of us don't see it, unlike myself in emergency medicine, I see all the time, we tend to ignore it. And we just can't do it. A lot of lives have been lost. And so that's the reason why the vaccines are being outputted right now. And we just need to understand that that's the best tool we have to prevent the unnecessary loss of life.
So sticking with this safety question, we had a few questions where people specifically wanted to know if this vaccine is safe for people of color. Was it tested on people of color? Do we have data on that, or do we just assume?
Oh, no, there's no assumption here. We have data. I am a person of color, hopefully you can tell. Yeah, so I studied that. Of course, we have to make sure that the communities of color were included, and they were. In the Moderna trial, about sort of 10% of the participants were Black, and another 13% were from Hispanic communities. In the Pfizer trial, it was actually 10% and close to 20%, over 20% of the Latins Hispanics were included. That is actually a great representation from communities of color in any trial. And so the answer to that, it was trialed, it was vaccines were given in these communities. They went to great lengths to make sure that there was a great distribution of all types of people in these trials. And so you should feel assured that, yes, the vaccines were not just done in the majority of populations.
That's great. I'm getting a couple questions in the chat that I wanted to pose to you. Unfortunately, because we live in New York and because of the breadth of this pandemic, many of the people who work for us have already had COVID and recovered. Is there a reason for them to get the vaccine? Wouldn't the vaccine work the same way the infection did?
Yeah, so great question. And so in the trials, they did include people who had been exposed to COVID-19 and already had natural antibodies towards them. So what they found was actually the vaccine was even a stronger booster of those antibodies, made them actually more likely to have increased level of antibodies, which made them less likely to have severe outcomes. So the answer to that is if you've been exposed to COVID-19 before, you can get the vaccine. It's recommended that you get the vaccines. You should not hold off on getting the vaccines. And so that's the short answer to that question.
That's great. We also had a lot of questions where people were concerned about fertility. Would this mess with people's ability to have kids? Is this safe if you're planning to have a child or planning to get pregnant in the next month, the next year?
So the answer to that is no, there's no effects on fertility. Women who were enrolled in the trials, to a large number actually, and women who received the vaccine have subsequently went forward and actually had children. So there's no effects on fertility. And so you should be confident that you can take the vaccine and you should be able to have children. There should be no effects there. So the trials were not done in pregnant women. So when you go to get vaccines, you have to make sure that you understand that you need to speak to your practitioner, your OBGYN, and see if that is actually something you want to go forward with. But I must tell you that those two trials, at least the current trials we have, were not done in pregnant women and they were not done in children. So right now, the recommendations are still not for those two populations, but you can still speak to your healthcare practitioner and make a conscientious decision, what we call a shared decision making with them and see if that's a route for you. But in terms of everyone else, women, there's no effects on fertility.
And what about effects on male fertility? We've asked those questions as well.
Yes, absolutely. So male fertility too, there's no effects. This hormone is not gender specific. It did not target any gender specific hormones. So it has nothing to do with hormones. It's really, as I explained to you, how the vaccine works. So there's nothing really in relation to fertility there.
That's great. We've had one other question. I wanted to let you underline this again. If people have already had the virus, do you advise that they get the vaccine?
Yes. as I mentioned just earlier, it gives you a much stronger response than what your natural immunity does. What we don't know is how long these antibodies that we create, how long they last. So some people who have gotten the COVID-19, they maintain their main antibodies. We've known that over 6 to 8 months, we notice that those start decreasing. The vaccine actually acts as a booster to increase that. We don't know how long the natural immunity will last for, and we don't know how long the vaccine-induced immunity will last for. So the recommendation right now is go ahead and get the vaccine, regardless of whether you've gotten exposed to the coronavirus in the past.
So once you get the vaccine and you've gotten the second dose and you've recovered and we know that you have antibodies, can you then take a mask off, go into a crowded restaurant and live your life as if you are totally immune?
Unfortunately not. So we don't know that if you are vaccinated, have antibodies, whether you have active virus and whether you're able to now pass it to somebody else who may not be protected. So the recommendation is you still have to wear your mask until we get to a certain level in the population. You may have heard about herd immunity, where a certain percentage, whether it's 75%, 80%, 85%, or 90% of us are totally vaccinated or have some sort of natural immunity towards this virus, that we can then all say the virus will no longer affect all of us and we should be free to take off our masks. But until then, we all have to wear masks. We still have to social isolate and self-distance ourselves. It is a long road. We anticipate by late summer, early fall, we may get there. But what will accelerate us being able to get to normalcy is making sure you get vaccinated so we can start the march towards herd immunity.
So people are asking questions specifically about the kinds of risk factors for COVID. So if you have hypertension, if you have diabetes, if you have an autoimmune disorder, is it safe to take the vaccine with those pre-existing conditions?
Yeah, absolutely. Actually, the studies were done with that in mind, right? So the studies were done in those specific populations because we knew that those were the populations most at risk, right? So that's the populations included. So the trials were done in 65 and older, patients with chronic comorbid conditions, diabetes, hypertension, obesity, because those are the people most likely to die from this. And so the answer is yes, absolutely. If you have a chronic comorbid condition like that, it's even more important that you get the vaccine.
Great. There are a lot of confusing things now about new strains of the virus, a strain from the UK, a strain from South Africa. What do we know about this vaccine and those strains?
So great question again. So we have the UK variant, which you have heard is more highly contagious than the current variant that we have. And then we heard about a South African variant. And now there's even a Brazil variant. The vaccines, the Moderna Pfizer vaccines both work well in still creating antibodies against the UK variant and the South Africa variant. We're still early on with the Brazil variant for me to say with absolute certainty where we are with that research. But just know that the two new variants that have been introduced, the vaccines have been done well with them and still give you some level of protection against them. So go ahead and get vaccinated.
We've had another question that I think it's worth asking. Do you know of any reason to believe that getting this vaccine would inject you with microchips or allow the government to otherwise follow what you're doing?
No, we don't. There is no microchips that's embedded in these vaccines that will let anybody track it. The technology is not there. There's quite a lot of misinformation out there, unfortunately. And the short answer to that is no. There is no tracking mechanism. There's no microchip. Bill Gates has mentioned one sort of about some sort of ink technology whereby if you put a smartphone over it, they could show that you got vaccinated, but that's definitely not a tracking mechanism where some satellite is tracking you. So no, there's no tracking, microchips, anything associated with the vaccine.
There are a lot of questions out there about preservatives in vaccines. Is there a danger to children or adults or any sort of developmental disability risk to getting a vaccine? What do you know about that related to this vaccine?
So great question. So right now, because the vaccine, the trials recently ended late last year, so 2020, you need to know that in our previous history of vaccinations and making vaccines, most serious adverse effects of vaccines are generally seen within the 6 weeks from the last 6 weeks when the trial ends. So that's why the FDA gave them 2 months to see if there were any adverse serious effects in terms of neurological problems. You guys may have heard of Guillain-Barré syndrome that have come up with some vaccines in the past. The answer was there were no serious neurological, rheumatological issues that came up with this current 2 vaccines. Now, we haven't had the vaccines long enough in terms of years for us to tell you if there's anything that will happen down the line. But again, that's years. We don't know. For what I can tell you is people are dying, and they're dying in our communities. And so we have to just take a measured approach about how we go with the vaccines. So right now, there's no serious adverse effects that have been reported.
Great. There's news out there that Johnson & Johnson is going to bring a vaccine to market, and that it might be a single-dose vaccine based on a different technology.
Mm-hmm.
Is there a reason for people to wait for that vaccine? Is there a reason for people to go get the Moderna and Pfizer vaccine now before that one comes out?
Yeah, so again, we're in the middle of a pandemic, right? So you want to make sure you have antibodies to protect yourself. Your workers, you guys are on the front lines. Clearly, you're out there helping communities who are in desperate need. And often it is in communities of color. And so being in the front lines working, there is no let me wait 3 years to see what happens. So really, you should just go ahead and get vaccinated with what's available to you. Right now, you have 2 vaccines that have really good safety profiles, and the science was there, and we have had scientists pour over the data. There were no shortcuts that were done, and it has minimal side effects. So it is a good thing to go ahead and take that. Whenever Johnson & Johnson finishes with their vaccination trials and releases that vaccine, that will be another tool in the armamentarium that we have. I don't know when that will be. And so should you wait till the middle of summer? Should you wait to the end of next year? Who knows? So just be mindful that we have vaccines that are currently safe. And my recommendation, and generally the recommendation of the CDC and the government, is to go ahead and take it.
Great. So I think we have to wrap up here. I want to thank you again for being here and answering all these questions. I know we have a panel coming up of some people at HELP who have gotten the vaccine to speak about their experiences. But I wanted, on behalf of everyone here and all of our staff members, to thank you again for taking the time to answer these questions. And to everybody here on the call, if you have other questions, either put them in the chat, you can email me directly, and we can direct you to resources that can help you get the exact information you need. So with that, I'll introduce Karen Ford, who is our Chief Operating Officer, to continue.
Hi, good afternoon, Help USA. This is Karen, your Chief Operating Officer. I just want to thank you, Steve and Dr. Azen Quayle, for that wonderful panel discussion. I saw so many questions in the chat, and I am excited to see that there are 267 participants. And as Steve mentioned, we have over 1,000 staff, but I'm sure that whoever it is that's on this the webinar is going to spread the word. So I'm excited and really to be able to bring forth a great panel of your peers, my peers and colleagues, that we're going to go through a series of questions about our experience with taking the vaccine. And I just want to first introduce Gina Park, who's our Associate VP of Supportive Housing. Thank you, Gina. Roberto Almanzar, our Assistant Cook at Audubon, and Tina Goodrich, our Executive Director of Homeless Prevention and Aftercare Special Projects. And Danny will talk about that title later. But thank you so much. But before we kind of get into some of the questions, we're going to go through a series of probably, I think I have about 9 questions here. I just wanted to come before you and say how personal this project is for me in terms of taking the vaccine. Many of you may know, and some of you may not know, that I am a COVID survivor of the first wave of COVID. I had exposure in February, got sick in March, and was really sick and diagnosed with COVID in mid-April, and was hospitalized in the beginning of May. And thank God and thank goodness for good health care, for advocacy, for my family taking care of me, you know, fighting to making sure that, you know, I got the medications that I needed, the support from leadership here. You know, I was able to pull through and come through. So for me, this is extremely personal. It was a very scary time for me, very scary time for my family and the children. You know, so I just want to stand in solidarity and also in sympathy and empathy with a lot of our staff who have experienced COVID, who have come through. We have people who are COVID positive. Our staff and our clients are testing positive every day, you know, and as Tom mentioned and Steve mentioned and Dr. Azen Quayle mentioned, people are dying, you know, but also people are living and we are surviving. And because we have survived, you know, I feel a personal responsibility to be a champion, you know, for our community and for all communities on the importance of getting the information and making your personal informed decision about why you should or should not take the COVID vaccine. So I took my vaccine also probably about 10 or 11 days ago. And, you know, again, with some soreness in my arm. The next day I had some fatigue, like headache, you know, took the Tylenol and, you know, I was back to work that afternoon. You know, so I'm going to ask this question to all of the panelists. Gina, I'm going to start with you. So there's a lot of conflicting information out there about the COVID vaccine. What kind of research, if any, did you do before you made the decision to get the vaccine? What resources did you turn to?
Yeah, so I think when the vaccination was available for us, I knew right away that I wanted to take the vaccination. So it wasn't until my appointment that I knew there was a questionnaire, and one of the questions struck me, and I think thank you to Dr. Azen Quayle for sort of providing clarity on that. But one of the questions was, you know, whether I was pregnant or considering pregnancy. And while I'm not pregnant, I wanted to do some more research. And, you know, as Dr. Azen Quayle said, there's limited information for those who are pregnant. So I turned to family members who are in the medical field, and without hesitation, they said, get the vaccine. Mm-hmm. So I also read an article, and I'm going to read this verbatim. It says the CDC previously said that while COVID vaccines in pregnant women haven't been studied clinically, they believe that Moderna vaccine is unlikely to pose a risk since it is an mRNA vaccine, not a live vaccine, and will be degraded quickly by normal cellular processes. So I personally found solace with the research that I did, and, you know, speaking to family members that are in the medical field, and decided to schedule my appointment.
Great, thank you. Roberto, I want to ask you the same question. What research, if any, did you do and that shaped your decision to get your vaccine?
Besides getting information from the CDC, my mom, she got a lot of friends that work in the medical field. So I talked to a few of them, and they recommend that, you know, that the vaccine is safe. Go ahead and take it. Since they work in the field, they specialize in that. They said, go ahead and take it. Right. That was the most important thing, you know, talking to people that know about the vaccine.
Right. Great. Thank you. Tina?
Yes, hi. So like Roberta said, most of my, not most, but some of my information came from the CDC website. But in addition to that, I'm a board member on a community healthcare center and I get a lot of information during the monthly board meetings about the COVID vaccine, so I felt safe about it. And then my next door neighbor, she's an infectious disease doctor. She got her PhD from Columbia University, and I asked her a lot about the vaccine. She's a very vocal person, and she would tell you straight up if the vaccine, she feels it's safe or not. And she said it was safe. As a matter of fact, she got it as well. So with that being said, I felt comfortable in getting vaccinated. And that's where my research came from.
That's great. I was one of the people who thought, because I have antibodies, I have like 2,800 antibodies, and probably more now, that I didn't need to get the vaccine. But then I checked with my doctor too at Mount Sinai, and she said absolutely that I should get the vaccine. But also I was privy to a webinar that was posted on by our Governor Cuomo from the Black Coalition Against COVID. And that same webinar is available to us. And there was a lot of questions, an hour and a half of an amazing dialogue and discussion on COVID, on the vaccine, from very well-respected and people of color in the medical field. And that really helped to shape my decision. It answered some more of the questions that I had. So thank you. Gina, I'm gonna go to this next question with you. What would you describe as the primary reason that you chose to get vaccinated?
So I trust that medical providers and the CDC and the World Health Organization all sort of have the best interests of people. To me, ultimately means I trust the vaccination. I wanted to be able to protect myself. I have a young child, my colleagues and the clients we serve. And so ultimately for those reasons, I chose to get vaccinated.
Great, thank you. Those are all really great reasons to do it. Roberto, this question is for you. At any point, did you consider not taking the vaccine? And what changed your mind, if that was one, if that was in your thoughts?
No, from day one, I just, since I had the information that I needed, I decided, I'm gonna go ahead and take the vaccine because of the work that I do, and also because I'm taking care of my mother now. So I want to protect her and myself and friends and family around me. So that was, big protective, give, a little bit of help.
Right. Great, thank you.
Okay.
Tina, I'm going to ask you, how did you get your appointment? Do you have to take a second shot? And if so, is it already scheduled?
Okay, yes. So once the email was sent out that we were approved, staff were approved to be vaccinated, I immediately went on the nyc.gov vaccine finder. And at that point, there were so many openings, I was surprised. And thankfully, one of the openings was at my doctor's office. So I hurried and scheduled the appointment, and that's how I got in. What was the second part of your question, Karen? I'm sorry.
And do you have your second, if you have to take a second shot, is it already scheduled?
Yes. So I took my first shot about 2 weeks ago, and I have the Moderna, and I go back in another 2 weeks, which is scheduled. So the great thing is when you get vaccinated, after you get vaccinated, you wait about 15 minutes and they fill out your vaccination card, your immunization card, and they schedule the appointment for you. So that's a great thing. You don't have to worry about trying to find an appointment to get your second dose.
Yep, that's great. Yeah, mine's is also scheduled for February as well, early part of February.
Yes.
Okay, we'll be on our way. Gina, this question is for you. Where did you go to get your first dose?
So I don't recall the website, sorry, but they had some nearby options. One was, I think, Canarsie High School. The other option was Bushwick Educational Campus. And so for me, I live closer to Bushwick Educational Campus, and they had some slots available for me. So I made and I have my second dose scheduled at the same Bushwick Educational Campus.
Right. Just speaking in line with the scheduling and access to vaccine, we as an agency and a community have been very fortunate to have access to the vaccine. I believe Missy put out an email yesterday that Damien Health Center has partnered, has reached out to us personally and has given us probably about, I think, 200 slots for the vaccine that we have been scheduling. And everyone already knows to, email Missy with your information and she will get you scheduled for the vaccine. You just have to go to our Wards Island facility. And then also DHS now have prioritized our population, and they have opened up the vaccine opportunity for both our clients and our staff. So I really want to admonish everyone to take advantage of this opportunity if this is what you choose to do. So Roberto, this question is for you. It's kind of like a two-part question, okay?
Okay.
So what I wanted to ask you was, did you have any side effects? And if so, what were they and how long did they last? And then which vaccine did you take? Did you take the Pfizer or the Moderna?
I took the Moderna, and the only and the only side effect I had was my arm was hurting like for 2 days. That's it. But besides that, I had no effect. Just the arm, I felt fine. I wasn't fatigued, no headache, nothing like that. It was good. Can't complain.
Good. So I'm very grateful that we have had the second day off, right? That was a good call, I told Missy, because I needed it. I had a little bit of fatigue going on that next day. My arm was sore for the 24 hours. And I appreciated having the time, to kind of rest. So thank you. I'm going to ask the last question to the entire panel again. And Tina, I'll start with you. How do you feel now? Are you glad that you got the vaccine? Do you feel any safer?
Right. So right now, I'm doing great. I feel great. Honestly, I've never been so excited to get a vaccine. I think all of us waiting, we were so excited to get vaccinated.
Yeah.
And the reason being is knowing that once a certain percentage of the population, what we call the herd immunity, we can get back to what they call a norm. So this feeling is a great feeling. It reminds me of voting. When you cast your vote, and you feel good about it and you're happy to promote it.
Yeah.
I feel the same way about being vaccinated. I'm just so happy and thankful, especially that we as Help USA employees got placed into phase 1B, because I honestly thought that I had to wait until summer to be vaccinated. So thanks.
Yeah, it's very empowering, right?
Yeah.
Yeah, I feel like I was able to take back, some of the power that I felt like I lost, like the doctor said, in this invisible war that we're dealing with, Gina, how about you? How do you feel?
I feel great. Just to sort of piggyback off of, what Tina says and what you're saying is very empowering. I see the light at the end of the tunnel. This past year has been debilitating and hard for many. And so, I'm just thankful that I can see the light at the end of the tunnel.
Yep. Great. Good. And how about you, Roberto? How do you feel?
I feel good. I can't wait for the second dose, so like that make me feel even much better, I think, after the second dose.
Great.
So can't wait.
Great. Good. And everybody's eligible on this call except for me for the gift card too. We're gonna have to, Tom, we have to rethink that plan because we should be able to get the gift card.
thankful to Help USA, giving us that time off. Because many may not have the time to take off.
I agree.
That could be a question of concern of trying to get vaccinated. When you are ready to get vaccinated, and as you see, appointments are really difficult. And sometimes the ones that pop up is the one you just have to take at that moment.
Right.
So I'm thankful to Help USA for giving us the time off, half a day, the day of vaccination, and then the following day. Oh, and the $50 gift card is a nice
And the
bonus.
gift card, yes.
Yeah.
Yeah.
Wonderful. You guys are real help heroes. You're champions, for your clients, for your community, for your families, right? You made a conscious, educated decision, one from from a place of science, right? But also it's a heart decision. I believe it's the decision that you made because you care, about yourself, you care about your community, you care about your family. And sometimes it's difficult to make those tough decisions, especially when you're dealing with a lot of fear, a lot of confusion, and sometimes we have to just walk through our fear and get as much information as we can and then make the best decisions that we can for ourselves. So thank you for coming on. And I'm really grateful to the entire Help USA team that have, really been a champion, right? We've been out there on the front lines. You guys have been holding down the facilities, the clients, the shelters. I just want to admonish you to also take care of yourself in this process as well. So I am going to toss back to Tom, and thank you, everybody on the panel. Right.
Thank you.
Hey, everybody. Thank you for spending time with us today on this town hall. Karen, can you hear me?
I can hear you.
Good, great. I always learn so much listening to Steve, to Karen, to members. I wonder if I was muted. Let me start again and say that thank you all for joining us on this town hall. And I've always learned so much from listening to Steve and Karen and really thinking about what they have to say. And today is obviously no exception to that. Karen mentioned in her remarks the themes of coping, resilience, and survival. Coping, resilience, survival. In thinking about this, these factors are key components of what we try to do every day at Help. This is what we help our clients with. We help them build coping skills. We help them maximize their resilience. It's what we're all about here. And now our focus has to be on helping all our staff, helping everyone who works here cope and survive as we make our way forward through this pandemic. So in closing, let me thank Dr. Azen Quayle and everyone from Help who has participated in this town hall, and wish you all the best and wish you safety and health as we go forward. Thank you and good day.